I'm joined now by Dr. Chris Hanby, and we're talking about hip replacement, hip pain. It's something when I think of it, I associate that with older people, but I know it can also be a problem for people who are young. So talk me through the process of when someone who's experiencing hip pain might need to come see a specialist like yourself.
Sure, yeah, people are really surprised. It's a common problem. Lots of people have hip pain, and it can be all ages, and sometimes it's something you're born with a different hip that can cause pain, or it can be an overuse injury that can cause pain. And so I definitely see kind of a continuum of people with hip arthritis or hip pain, hip injury. And yeah, I see sometimes young people that end up with a bad hip that needs to have hip surgery. Sometimes you can treat hip arthritis or hip injuries with physical therapy, rehab here, medications, but sometimes it does require surgery.
What's the tipping point of when, if I'm experiencing some hip pain, I would need to come see someone like yourself?
It's a great question. To me, the two things that I always tell people are pain and function. I have some people say, man, my hip hurts all the time, but I'm still doing everything I want to do. Well, that still worries me. If you're having a lot of pain that's, noticing it all the time, probably should check it. I have some people say, I don't really notice much pain, but I notice people asking if I'm limping, or I can't move my hip like I used to, or my activities are decreasing. So I think either of those could be a reason to see an orthopedic surgeon.
Yeah, that's a great tip. So let's just say that I come to see you and we go through a diagnosis and I do need to have that surgery. Can you kind of take me through the process of what that procedure is like?
Absolutely, yeah. I think I talk to people a lot about hip replacement as people think about this really big surgery, and it still is a major surgery, but if you think about hip replacement now compared to 15 or 20 years ago, it's become a lot more minimally invasive. We're doing a lot smaller incisions, a lot more muscle sparing. We're not cutting like we did in the past, and so a lot less bleeding. So people come in the day of surgery. Surgery takes around an hour. I have some people that go home the same day, and if not that day, the next day. So most people aren't in the hospital more than 24 hours these days, so that's good. There are obviously some risk with the surgery, but we've done a lot of things to lower that risk now, and a lot of things to speed up the recovery. We have healthy patients that they'll go home same day or early the next morning. They'll start physical therapy within a day or two, and that's obviously important. I tell people there's usually a month of some good physical therapy to get the muscles working again, get your range of motion back, and so people are slowed down for those first several weeks with the therapy. But it surprises me. I have some people going back to work within a week or two. Some people it's longer than that, but people can get back moving pretty quickly after hip surgery.
Yeah. So Dr. Hanby, if viewers are watching right now and they think they might need a consultation or know a loved one that does need a consultation, how can they reach out to you?
Sure. Yeah, I'm at Ozark Orthopedic Clinic. I'm here in Fayetteville or Bentonville, and you can always go to Ozark Orthopedics on the internet, or you can always call our number too.
Joining me now, we've got former Razorback and Pittsburgh Steeler Steve Conley, who has had the hip replacement surgery performed by Dr. Hanby. Thank you so much for taking the time to visit with us.
Thanks for having me on the show.
So I'd love to hear a little bit more about your experience with this. When did you know you were having trouble with your hip and you needed to see a specialist?
Well, 2 or 3 years before I actually had the surgery, I was out with my son, and we were in Orlando for a youth pro football game, and he was out there performing, and I couldn't keep up with him, and I couldn't enjoy the time with him because of how much pain I had in my hip. And the last straw was I was in Orlando's airport, and I couldn't get to my gate. I had to be pushed in a wheelchair. I said I could no longer live like this, so that's when I knew I had to get the surgery.
What was the process like for you from your diagnosis and then deciding that you wanted to go ahead and go through with the surgery?
It was very humbling because, being an athlete all my life, being able to get up and go however I feel and love to run and bike and things of that nature, I thought that I was way too young to get this surgery. But talking to a lot of people who got the surgery, actually received the surgery from Dr. Hanby, they said, the first thing they said was, I wish I would have did it earlier.
Yeah, and you're obviously in great shape now because you're working with world-class athletes. We just had a chance to see Isaiah Joe work out here in the gym, getting ready for the NBA draft. So obviously it's meant a lot to you to have the surgery done.
This is my passion. My passion is to train athletes and train people to get them in shape. People like Isaiah Joe, Sidney Conley, to get them ready for their professional careers and to be able to keep up with them, to demonstrate their exercises again. It's huge.
Yeah. Dr. Hanby had some great tips for those who are experiencing any kind of hip pain and what the procedure is like. And then we heard from Steve Conley, a great testimony to what having that hip replacement surgery can mean for you and your life. And I'm feeling so inspired right now, I think I'm going to go work out. We'll be back with more Good Day in WA.